Great. Good afternoon, everybody. My name is Audrey Schott. I'm the Rural Health Initiative Project Coordinator. Welcome to our second webinar in the Building Active Communities Initiative series. Today we have Ryan Leland from the City of Helena and Ben Brouwer from the Lewis and Clark City County Health Department presenting on transportation engineering and public involvement. Before they get started, I just want to go over a few technical details. Like I said, all the lines have been set to mute. To unmute your line, press *6. We will have a few breaks during the presentation today for Q&A, and if you want to ask questions live over the phone, just press *6 to unmute your line and ask your question. If you would prefer to just type your question in, there's a question box on the right-hand side of your screen. You can type them in, and they will be sent to Ben and myself, and we will either answer them. If it's a technical question, I will answer it for you, and Ben will hold questions and pose them to Ryan at our question breaks during the presentation. With that, I'm going to hand things over to Ben, and we'll get started.
Great. Thanks, Audrey. Can you hear me all right?
Yep, we can hear you loud and clear, Ben.
Okay. So thanks again, Audrey, and thank you to the Rural Health Initiative for hosting this webinar today. My name is Ben Brouwer. I'm a health educator with the Lewis and Clark City County Health Department. And part of our work here is focused on the built environment and active transportation. This webinar is one in a three-part series that was originally envisioned as a way for those of us in the public health profession to get up to speed with some of the terminology and design concepts that transportation engineers and planners use every day in their work. Basically, we wanted to be more familiar with these concepts so that we could participate more effectively in local transportation planning efforts as proponents of walkable, active, healthy communities. The series is offered in partnership with Riverstone Health in Yellowstone County and the Montana Nutrition and Physical Activity Program at Montana State University. The webinar is part of the technical assistance we're providing as a team to 6 cities and counties that are part of the Building Active Communities Initiative. The Building Active Communities Initiative and this webinar are supported by a community transformation grant from the Centers for Disease Control and Prevention and the Montana Department of Public Health and Human Services. I do need to point out that any opinions expressed in this webinar do not necessarily reflect the official views and policies of the U.S. Department of Health and Human Services or the Montana Department of Public Health and Human Services. For those of you not aware of our work, the goal of the Building Active Communities Initiative, very briefly, is to support Montana communities in adopting and implementing standards at the local level that make our cities and towns safer, more inviting places for walking, cycling, and other modes of active transportation. And if you're interested, if you want to find out more, please go ahead and contact Kathy Kostakis. You can see her phone number and email listed on your screen right there to find out would qualify for participation in the Building Active Communities Initiative and how you can get involved. As Audrey mentioned, our presenter today for transportation planning and public involvement is Ryan Leland. He's the engineer for the City of Helena. He's held the position for the last 10 years and in that time has overseen dozens of transportation-related projects. He's also an advisor for the Building Active Communities Initiative. And we've asked Ryan to cover some of the important terminology and design principles that transportation engineers use in their work. We've also asked him to cover some of the policies and standards that most local governments have in place to guide the construction and maintenance of their streets, and to outline the steps that typically go into designing and building streets under different jurisdictions. Through all of this, what we're hoping is that Ryan can share some insight into how transportation planning happens in Montana communities and how we as health professionals and active community proponents can participate in that process more effectively. Also, as Audrey mentioned, there will be a couple breaks throughout the presentation for your questions, either by unmuting your phone, pressing *6, or you can go ahead and type your questions into the chat box, and we'll get to as many of those as we can. So with that, I'm going to go ahead and pass it over to Ryan, and Ryan, you can take it away. Ryan, you'll need to press *6 in order for us to hear you as well.
All right, can you hear me now, or
Yep.
am I still muted?
You're loud and clear.
All right. I'm Ryan Leland. I'm the city engineer, as Ben mentioned earlier. And hopefully everyone can see the screen now that has transportation engineering and public involvement. Is that working?
Yep, we're all set.
Okay. And please ask any questions that you have. I can go any direction that you want. The more questions you ask, the more information you're going to get and actually go in a direction that you really want the presentation to go on and get the information that you need, because there's so much out there, and I can go from very, very basic to get very involved in what we look at. So the more questions you ask, the better it's going to be, and I can just go in any direction. I have a plan of what we're going to do, but I can switch from that, and it's not a problem to be able to go through that. This is my first time on a webinar, so bear with me, make sure everything works. This is just an overview of the presentation. We're going to take a look at concepts, terms, differences, because there can be some confusion of what you're really asking for, so that the transportation engineers and the planners know exactly what you're trying to get and not get caught up in just terminology, so it saves time. Then there's also when you best can present your concerns for change. So there are many different layers on what you're trying to change, and there's certain times that work better for when you can actually present your concerns, your ideas, and make changes at different times. They're all good ideas, but certain timing makes a bigger difference. Then I'm going to go through some standards and some studies that we have done in the city of Helena, and I'm using mainly examples for the city of Helena, but going to try and make it relevant for all the other cities that are out there. It's pretty generic, but they're the examples that I do have. And then I'm going to go through some examples that we've done in the previous years that have come about or been changed by people presenting their concerns, their ideas at the right time, under the right circumstances, and then we were able to make changes. So you can actually see projects go on the ground for what you want and how you end up presenting everything. So we'll just move along here. These are some basic terms that we need to go through. One is urban routes. There's state maintained and then there's city maintained. Urban routes are designated routes throughout any city, any of the major cities, and also even some of the smaller cities. You're going to have urban routes. They go through a jurisdiction, a municipality, a county, any of them that is controlled by MDT and has a pot of money that can go ahead and be allocated the money for these urban routes that go through the different cities. So the allocation just frees up money, but also with urban routes is they also have to be approved through the state. If they're state maintained routes, where you're looking at the major roads, such as in Helena, where you're looking at Montana, Lindale, Euclid, they're maintained by the state. They are basically going to have to do every project within them. They're going to design it. We can give them suggestions, but it's going to be an MDT project. If you have an urban route, such in Montana or in Helena, is like Park, Broadway, some of the major routes that go through that are controlled by MDT but are maintained by the state, they will be state projects. We can design things on them. We have a little more freedom to be able to do that. It still has to be approved by MDT, but we have more freedom and can actually do the projects ourselves. Then we're going through, we have some street classifications that are out there. We have local, collector, arterials, and you can look at vehicle trips per day. So a local one would be less than 1,500 vehicle trips per day. A collector, there can be different collectors, such as major and minor collectors that go from 1,500 to 2,000 or to 5,000 vehicle trips per day. And then arterials, there's the 5,000 to basically indefinite. Above 15,000, you get into your major collectors or principal arterials. Then that designation and classification of the roads set what features can actually be associated with each of the classifications. The bigger ones, the collectors, the arterials, you can start to see bike lanes, multiple lanes, center striping. You're going to have a lot more striping and a lot more control over those type of classifications than you are on a local road. A local road is going to be 25 miles an hour, designed to 25 miles an hour and under, where the collectors can get up to 35 miles an hour or higher. So you're looking at 25 to 35, and then the arterials can ones, just going through real fast, is right-of-way. Right-of-way is just the designation of land. It's usually bigger than what you're seeing in the street. You're going to go outside of what the sidewalk is. Typically, the sidewalk is within the right-of-way. It's land controlled or owned by either MDT, a municipality, or a county. Typically, the cities and municipalities have right-of-way. MDT has right-of-way, but counties usually have easements. So there's a little difference of what you can do, a little more control over a right-of-way than an easement. Talking about crosswalks. Crosswalks are a big thing that comes up with active transportation. Crosswalks can be a touchy subject here. There is, by state law, there's a crosswalk at every intersection, T intersections, four-way intersections. They are all considered intersections and are designated as a crosswalk for pedestrians. Pedestrians have the right-of-way at every single intersection, and traffic should stop for them. Just because it's marked just brings more attention to it and tries to alert the driver more than anything. But at any crosswalk, you do have the right-of-way, such as a pedestrian, so you don't have to have as many crosswalks. Mid-block crossings are never a real big fan for transportation engineers. It causes conflicts, and there's studies out there when you get into multiple streets, we have multiple lanes, to go across those lanes is actually more dangerous than having a single lane or control. So we try and force at least the marked crosswalks to the controlled intersections because they're safer. You can still cross it in an unmarked crosswalk, and the cars should stop for the pedestrians, but it gives a false sense of safety. Then we'll just get into some traffic calming because that comes up also with active transportation to get pedestrians across safer. Won't get into different types, just talking about how you would go about getting some traffic calming, some bulb extensions, traffic circles, anything along those lines that may be needed along a pedestrian corridor. Then getting into intersection grading. And I have a slide down that'll show exactly what I'm talking about. But each intersection is actually graded for a level of service, and they are based on peak hours of AM and PM. So that comes back that the intersection and streets are designed on peak hours. They're depending on what the street is or when the traffic flow comes. That's when you can start to get over here to demand management and look at how you control the demand and maybe not have to have so many peaks if you can, or such a big intersection for a very short duration of a peak. Then you're looking at some design and turning radiuses. That can make a big difference, especially for pedestrians. If they're using, say, a W64, which is just a design vehicle which ends up being a semi with a pub trailer, they have turning radiuses that we have designs and computer programs that can actually tell you how wide that corner has to be to let those trucks go around it and turn on it without going into another lane or up onto the sidewalk. So if you're using a much bigger design vehicle than you're really going to see, those intersections are going to be extremely wide because you have a huge radius on those corners and intersections, so it just makes it for very wide and sometimes hard to cross for pedestrians. That's why we'll look at big intersections to have medians and refuge islands to try and make it a little safer and not have to spend so much time. That gets down to the design vehicles that I was talking about, is try and figure out exactly what the vehicle is going to use the route as the design vehicle, because the bigger you get, the bigger the intersection is, so make sure that it's appropriate, and that's how you can shrink some of those intersections that are out there. A lot of times, as an engineer, as I am, safety factor is out there. We like to use the bigger vehicle because it is safety to make sure everything's going to work, so we tend to go with the bigger vehicles when at all possible. Then it goes back to also the turning radiuses, goes back to right-of-way. You may need more right-of-way or might not have enough right-of-way, so you'll have to have shorter radiuses to get vehicles across, and then you just have to deal with some of the issues that are out there. Another one that is big is the emergency services, the fire trucks, the ladder trucks. They have very large turning radiuses, so you have to sometimes make them wider. Another one that I do have an example of is crash data. Is we take and look at the intersection, and when we base our decisions of what we want to do to any of the intersections, such as stop signs or bulb extensions, anything along those lines, we go right to the crash data. That is reported from the police. These are formal crashes that are out there. There may be ones that people have witnessed but have never been reported. We do not see them, but this is our first line that we actually go and look at for a 10-year period to see how many accidents that are out there. It is surprising that a lot of people say, yes, we have a crash here every day, and we go and take a look at it, and there's only been 2 in 10 years. So there can be some misconceptions, or maybe we have a problem of not getting stuff reported since there's a crash. Sometimes they just pay out of pocket. So that could be an issue that comes up, but we have our crash data that we look at. So if you bring up an example of a bad intersection or a troublesome intersection and you don't have the crashes that you think are out there, it's just where we're looking at it is what we go off of. Then we go back to the grading of the intersections. We have the level of service. And the level of service for the street is actually based on the intersection. You can sometimes get a street that has way too many vehicles for what it can handle, but typically it's the intersections that's going to break down first. That's where we look at the level of service, and then we do the grades. It's A through F. You can look at it. It's 10 vehicles per day. Or 10 seconds per vehicle is an A. Go all the way down. You can read them there. Typically, we want to be at C. Once we get below C, anything we do for improvements or for development, we want to try and bring it back up to a C. Yes, this is based on vehicles. It's how we do transportation engineer. We look at the cars and the vehicles first. We are moving a different direction to look at more multimodal of pedestrians, bicyclists that are adding into these level of services. We don't have a lot of good data, especially here in Montana, and there aren't a ton of pedestrians that really overwhelm an intersection. So right now it's still with vehicles, but we are looking at pedestrians to mainly make it safer, but you could have a breakdown of level of service in an intersection if there is a high population of pedestrians that are using that intersection. Then going back to demand management, since all intersections and roads are basically designed for peak hours, is if you can spread out that peak with demand management is mainly looking at carpooling, busing, just a way to not have to increase the overall capacity of the roadway or transportation system by just talking to people and having a different demand to go out there. So if you have carpooling, you don't have as many cars, you're saving money in the long run, but yes, you're moving more people instead of just a few number of people in large vehicles. Carpool lanes to try and promote on interstates. I think everyone's seen them to promote that. They're trying to just get demand management and spread it out so they don't have to keep expand the transportation system. So if you can get people on bikes, takes them off the roadway, it helps out. Other things you can think about, talk to is some of the bigger employers like the state or say Blue Cross Blue Shield here in Helena or any of the other really large employers. If you can have them shift their hours of the employees, maybe not all of them, but a few of them, to let them come in at 7, or some of them come in at 9 and then they stay later. So if you can shift the hours that they're actually employed, will limit the number of people that are on the road. It just spreads it out. They can come in at different times, and it may be a different alternative to be able to not have to expand that roadway. Design speeds, travel speeds, and speed limits. This is a real touchy one because everyone looks at it and says, I want a speed limit of 15 miles an hour on the road. The road, typically when we look at it, is designed for a safety factor. We're looking at 30 miles an hour, which you're looking at, say, sight distance, especially on gridded systems in urban areas like Helena and Billings. You look, the design speed is basically the radiuses around any of the corners that you have, and also sight distance is what we're looking at. So we're going to try and make it a little more comfortable and have everything to facilitate somewhat faster speed. It's a safety issue, but we don't want to go too high because then we remove a lot of parking in downtown areas or residential areas. And then if you have a driver that feels comfortable, they tend to go faster. So one of the elements, say in transportation engineering, if we can make a driver feel uncomfortable, the speeds tend to decrease. So that's a little game that we can look at, but a design speed is purely how we're going to design the road, what we're looking at. Does not mean what we're going to set the speed limit at. You have then what are actually people going out and traveling. That's where a speed study comes in and the speed limit is set. Is the speed study and speed limit is you go out there, you record the speeds that are going on, seeing what the actual travel speed is, and then you take the 95th percentile, and that is your speed limit. You can set it within 5 miles an hour, either faster or slower. Typically it goes slower, but you have the 85th percentile. You're going to have people that go faster, and you're going to have lots that go slower. But that is where you set your speed limit at, is the traveling speeds. What it comes out, if you set a speed limit that's way too low, unless you do something to that roadway, people tend to travel at the speed that they feel comfortable. So just lowering a speed limit doesn't actually make it any slower. A few people will, but the majority of people will not. So that's why we set it based on what the traveling speed of the public is out there. So just moving on, this is an accident report that we look at. This is for a 10-year period. This is one of our major intersections in Helena, just taking a look at it. This is what we come in, we look at. We have 3 right-angle crashes. Someone's turning or taking a left turn, someone hits them while they turn. Then you have a right-angle crash, is that they actually come into the intersection. 2 people are going at the same speed. You can see a couple of nighttime crashes, a side swipe, and then just rear-end accidents. We look at the predominance of how many accidents we have, what kind of accidents we have, and then look if there's anything we need to do to this intersection, stop signals, stop signs, roundabouts, anything along those lines to try and help reduce the number of crashes and make it safer. This one, we did have a complaint about a pedestrian safety. We look at it, there's actually no pedestrian accidents, so we have a hard time saying that this is a real dangerous intersection. It may be. We are going to monitor it and see if there are issues out there, but this is the data that is presented to us. This is just a blow up. If anyone couldn't see that slide before, you're looking at, we have, some in 2005, 2004, 2003. We had a lot of them. And then from then on until 2008, 9, 11, and 12, we only had one each year. So either we did something to the intersection, or it just, we'll have to evaluate it because there was a drop-off and see why we had that drop-off in the year. This is on the slide. This is the Greater Helena Transportation Plan that I'll talk more about, but this just gives an idea. Is we have all the intersections or major intersections graded to see our overall transportation system. If you're starting to see E's and F's and D's, that means that there's over-congestion. We need to do something because the worse off that the intersection is, the more crashes you're going to have, and you're going to have pedestrian problems, and you can really have some dangerous intersections when it breaks down. So just looking at, you have the AM peak and the PM peak. So that gives an idea of what we're looking at. This is just a slide just to show that and I had another one, so I just threw it in. Might be real basic, but you look at the edge of right-of-way is on the other side of the sidewalk. Typically, the sidewalk in most municipalities and on the state is owned or is within the right-of-way, so we have jurisdiction on it. Some of the other street features, I know Joe talked about it, but just when you're talking width and for parking lanes and driving lanes that control speeds and pedestrian safety, is you have edge of pavement, and then you have the curb and gutter that can be used for bicyclists or not. It kind of depends on your town and your municipality of what you're going to look at. One thing that causes a lot of confusion that is out there, and the more I'm talking, is I want to try and make it as easy and concise for you to be able to get your point across without it having any confusion and wasting any time or getting frustrated because they don't understand what you're trying to portray to them. So some of the differences that can cause problems is maintenance and reconstruction. It's different in MDT or city and county. I'll go through that. You have studies and design plans. There isn't much confusion on that, but it's more of a timing issue, and timing is a big deal. Then you have to know of like sidewalks, multi-use paths, bike lanes, share the road, and typically when transportation engineers look at it, if there's a multi-use path that's a bike path for pedestrians, we tend not to want to have bike lanes associated with it because bicyclists can travel on the path. However, I do know commuter bicyclists and some of the faster bicyclists do not like riding on the trail because of the conflict between pedestrians and bicyclists. So is a bike lane and a multi-use path warranted, or is share the road and a multi-use path, and they're on a case-by-case basis. So you have to look at what you're trying to portray, and if you say, I want a bike lane, and there's already a multi-use path, a lot of the transportation engineers are already saying we already accommodate what you're getting at and just use the path. So you'll have to do some more justification. With bike lanes, a lot of the conflict and a lot of the fights that we do come in and discussions that we have is removal of parking. In some areas, parking is very important to the adjacent property owner, and some of the issues that come up can be very emotional and can cause a lot of discussion to see which way to go. So if you're looking at helping out, one thing you can look at is, and I'll talk a little bit more later, is to do some footwork to try and get buy-in by adjacent property owners. Then a lot of people, this is, you have signals that are out there. They're the red, white, or the red, yellow, and green. Everyone knows as a signal. Street lights or luminaires, as a lot of transportation engineers refer to them, are the luminaires that just illuminate the intersection itself. So if you say, I need a light at this intersection, typically it's looked at as a street light, not a signal. So it is a little different when you look at it, is just refer to the signal if that's what you're looking for, or a light if you just need some more illumination to try and make it a little safer for whatever reason that could be out there for pedestrians to be seen better. And then you have traffic calming and stop signs. I bring this up is because stop signs are not used as traffic calming. Stop signs are used to designate right-of-way, and I can get into there more, but don't think that you're going to calm traffic or slow traffic down by putting a stop sign out there. There's studies out there that show that it really does not affect how fast people go. If there's a pedestrian, it does have a controlled intersection, and typically they stop more, but we typically do not look at a stop sign to calm traffic, to slow traffic down. We have specific engineering structures that we can put out there that will physically make people uncomfortable and tends to either have the more prominence of a pedestrian coming out there, can be seen easier, and then the traffic can calm down, or actually makes them slow down and change direction. At this point, that's just a rough overview of what we look at for transportation engineering. Some terms. Is there any questions, or if I can go back or do a little more, or any questions that anyone has?
So, Ryan, we can go ahead and start with a couple of questions that popped up on the chat window. One question was, can demand management also include biking and walking as well as modes of getting people out of their cars and into different modes of travel?
Oh, certainly, and yes, that's one that we look at is if we can get people to walk, to ride public transportation, to bicycle and commute, that's a huge portion of what we're looking at as far as demand management. If we can get a large enough number off the street and onto either walking or biking, that is more time that street is going to be viable and not break down, so we won't have to do so much of a reconstruction, and maintenance is even prolonged because you just don't have the pounding that is needed for the vehicles that keep coming. Yes, that is a huge portion, and something we strive to do is to try and get people out of their vehicles just to help with the intersection itself. But yeah, that's a very large portion of the demand management.
Great. One more question that popped up about level of service and specifically pedestrian and cyclist levels of service. Can you explain, is a pedestrian or cyclist standard equivalent to the automobile measure of level of service?
Typically, there isn't a great level of service calculator for a pedestrian or for a bicyclist. Typically, we look at a bicyclist unless it's on a sidewalk, which they are allowed here in Helena. I know a lot of organizations do not allow bicyclists on the sidewalk, but they are treated as a vehicle. So yes, if it is delayed, we would use the same level of service as the vehicle. As far as pedestrians, we don't have a real good feel of what a level of service is for pedestrians, but typically the vehicles are the ones that are going to control everything. I would say it'd probably be just a little bit longer for pedestrian is how we look at it, but it's not to say that it isn't taken into account. I don't have a real great answer for this, but yes, the pedestrian, we don't have a good level of service of what needed as far as delay out there. I know they're working on it, and there's a few organizations that are coming out, but right now, we don't have a good feel for level of service.
One more question that just popped up for you, Ryan. How do you measure the level of service of an intersection? What are the actual considerations that you take into account when measuring a level of service?
Measuring level of service is actually we take cars, drive through intersections, and actually time it. When we stopped at the intersection, how many cycles does it typically take? We're just observing the intersection. Does it take one cycle to get through an intersection of the signals? And if it does, and I'm just talking signalized intersection right now, that's usually an A or a B depending on how big the intersection is. If you have to wait multiple cycles for the signal, that is when the level of service is going to start to break down. But we just observe it, we drive it, and we actually do times, and then it's going to be just an average of the level of service in the AM and PM peak. Typically on other hours of the day, it is graded better and performs better level of service just because there usually isn't as high a peak stretched throughout the day. But then some other things that we look at is what is the capacity of the road. We know what capacities of the roadway are based on speeds, right-of-way or designated of right-of-way. So if it's a through street, has 2 lanes at 35 miles an hour, it can handle so many vehicles per day. Now with our traffic count, are we starting to see that we have too many vehicles traveling on a 1-lane road? Yes, the intersections are breaking down, but we actually need to look at widening that road, not just do something at that intersection. So we look at the capacity of the roadway and then how many vehicles are actually traveling on that particular route to see what the level of service is, and do we need to expand the whole corridor? Do we need to look at trying to move some of the traffic, or do we look at the intersection, just do intersection improvements? Typically, that's where you see the backup and the major delays that are happening. Rear end accidents
Ryan, we have one more question that just popped up about turning movements of larger vehicles. The question is, what data is available regarding escalation of turning movements by larger vehicles, intersection design, lane width, etc.?
There's a lot of data out there. There's a lot of different softwares that are out there that have the different vehicles between emergency services, fire trucks, for semis, for pups. It's more of looking, and all that data can be found on the internet. You can just type up design vehicles, W64, anything along those lines, and just see what type of radius that is going to take into account. It's more of looking at that intersection to see if that vehicle is actually what you're going to see. Are you going to see large numbers of those vehicles, or is it a one-time occurrence? Could you actually have, if you're only going to see a semi or a fire truck there once in a while, could they go into another lane, or could they go up onto the curb, and then you can bring it in closer? It'd be more of looking at which design vehicle actually needs to be out there. But if you want to find out what the turning radius is of a semi, of a Suburban, of a semi with a pup along it, yes, just type it into the internet, and you can come up with all the different turning radiuses, and they actually have templates and see if it's going to work or not work. But MDT routes tend to be a little more conservative because they have ideas to keep a vehicle in the lane without going over less conflict, but you can look at that. Lanes, widths of lanes are typically set, and they're set through some different standards as far as AASHTO and ITE. The arterials, you're looking at 12. They're pretty well set. You have 14 foot for MDT ones for what we call a suicide lane, where it's a turning lane in both directions. And then as you go down in the classifications, they tend to get narrower. And then one of the standards for a local road or any road is minimum driving lane is 20 feet for emergency services, and that comes up through a national standards for emergency services.
Okay, Ryan, let's go ahead and move on to the next segment. I know you have more to present, and then we'll have more chances for questions down the road here.
All right, hope I'm not babbling too much. Get moving on. What I'm looking at here is what's the most effective way to communicate. And this is just from my perspective, looking at it as a public employee. I've talked to other employees from other municipalities and at the state, and just when is it best to be effective? Because what you're looking at is you're establishing basically priorities. Is everyone comes up and says this intersection or this roadway needs a bike lane, bike path, sidewalk. If it's a city responsibility, you're competing against other roadways that are deteriorating for cars, that may have a low grading, maybe an F, may have accidents. So you're establishing priorities if there's a specific project that you need done. So that's what you have to keep in mind, and that's just the perspective I'm coming into at it, is know what you're asking for to be added or changed. Because everyone here, if you're going to come up with a concern of something that you want, is actually when is it most appropriate? Do you want to add features such as a section of sidewalk just in this specific block? I want a bike lane on Euclid, or do I want, such as having in Helena, do I want a sidewalk that is installed with a new subdivision at when the streets go in? Different timing is going to affect everything. So if you come in at the right time and present your changes, such as streets, you need to do that during the subdivision review. If you want a specific sidewalk put in, you would have to come in when a project is either going on or try and get a project to be on a priority list for the commission. Other ones, numbers count. Is the more numbers you have, the petitions are very, very important. One person coming in, yes, we take that complaint in, we look at it, but if there's an overall neighborhood organization, a couple of them that we had, or there's a bike club, something along those lines, if you have a larger organization that has more numbers, it is weighted better. One thing I would say is if you're coming forward as an organization or representing an organization is have all your goals common, be one with the goal, everyone understands what it's going to be when it comes forward, and be organized. Have one person that's going to do the talking, one point of contact. It's just easier for the city or the state, for the staff to actually respond, and it is a time game. The more time is spent, the harder it's to get through everything. So you can make it real easy and effective for a staff person to communicate with someone to get the correspondence, the better it's going to be. So if you're organized and you have a goal, you have a very good chance of getting something changed or included into a project. Another one is go to your committees. If we have a non-motorized committee in the city of Helena, we have TCC. TCC is out there for many of the organizations. You have HCC, which is another citizens group, but know which committees that you have to go and talk to them to see if you can get them on board, or just present your ideas to them of how to change some of the demand management, how can we approach some of the employers, bike lanes, bike routes, overall biking and pedestrian networks for the municipalities or the cities. If you can talk to the committees, that's the first contact I think you should go to, and just be able to contact them, or staff is going to bring them to the committee. You'll need to talk to them anyway. And depending on the project, money talks, and everything that you look at is money orientated. If you're a neighborhood group that you want to get traffic calming, sidewalks, bulb outs, signal, anything along those lines, it's a priority list. If someone comes forward and has money available, doesn't have to be all amount, but a little bit comes forward, that goes up on the priority list. It means everyone is interested in it. They're willing to put some of the skin into the game, and they're not just looking for, a handout per se. It's not really a handout, but they're looking for someone else to come forward with the money, and it's a very limited pot, and you're competing a lot of different priorities. So if you have some money out there, that's going to jump you up on a priority list. Or if it's an organization that you're looking at, to go ahead and start to put some of the grants out there, or do some of the footwork to get some of the grants to come forward. You can start to get some of the projects, the on-the-ground capital projects, and is more what I'm talking about, completed and moved up on the priority list. Then if you're looking at studies or at regulations where you're trying to get complete street resolution, sidewalks associated with the subdivisions, go to the public meetings, and the commissioners do listen. Is to be there in person, have it organized, know what you're going to say. But I've seen several, and I have some examples of where you've seen the changes just by going to the public meetings or going to the commissioners. So if you're out there, if you're looking at the transportation studies for any of your municipalities that are out there, go to those public meetings and make your concerns known. All right. And then these are the different layers, is what you're looking at. If you're going after major global changes, if you're going to want something changed and you look at the subdivision regulations, they're just going to be global changes. You're going to look at sidewalks. Not what type of sidewalks that they look at, just sidewalks, bike lanes on a certain classification of roadways for new subdivisions. That is what the subdivision is looking at. There's a lot of misinterpretation that if we come in and change the subdivision regulations, it's going to change existing roadways. It doesn't. It just does whatever is going to be new development out there. So the subdivisions are looking forward. You're going to have to look at the transportation plan and talk to the commission to change the existing streets that are located within a municipality or any of the existing transportation network. So the subdivisions are new. The transportation studies are for the existing. If you're looking at engineering standards, if you want something changed, this is mainly new development. We do look at it for existing development when we're going to do new constructions if we can fit it in. A lot of the time it's based on right-of-way width, but these are specific requirements. It's It's not just a sidewalk. It's a 5-foot sidewalk this thick, a bike path that's 10 feet long, bike lane that is going to be 6 feet wide, 4 feet wide, 3 feet wide. What are we going to allow? How is it going to specifically look on the ground? And then do you want a bike lane and parking, or remove parking and put in a bike lane? That's specifically what it's going to look like on the ground, how wide you want to see it, what type of surfacing is going to be out there. Then, as I said before, is you have the studies. When you look at the Greater Helena Transportation Plan, which I'll bring some different ideas up there, are where you're going to look at specific projects. I want a bike network that goes all the way across, that uses Euclid, Montana, Broadway, just throwing out names. This is where you're going to have your public input in. That's where it's most effective. Go to the public meetings, write in, stay active, get people on board to say, I want a bike lane on these locations, an overall biking network. And that's just with the big reaching master plan studies that are out there, is this is where you look at some of the intersection requirements, the problems that are out there. But this is what's going to get changed and what's going to go on the ground when projects come out and the capital project plans are looked at, not only by the state, but also the city. Then you have the design plan. Is when the plans are in design, we take what the study says, and then we start to design the certain plans based off of capital improvement prioritized by a commission. Then we go in and design specifically what is looked at in the study, or you get smaller studies such as the Great Northern, just neighborhood area. We take those inputs off of the studies, and then we do the design. A lot of times is if it's not in the study and you want it implemented into the design plan, especially for MDT projects, because they're several years out in the design and getting everything taken care of, it's very, very difficult to get it in. So the further you move down of trying to get, just throwing out there, a bike lane, it can be very difficult, especially if you need to increase right-of-way or lane width. It's not as easy as just striping it in there if there's not enough right-of-way and not enough pavement width, or if you have to remove parking. It becomes a little more difficult and time-sensitive when the plans are out there. I've seen it done. MDT has been able to do it. They did it on 11th Avenue. But once you get into the design plans, it's getting pretty late in the overall game to come in and start to make changes. So when you start to see some opposition, when you come in with some good ideas, it may have needed to go back in with the study. So you have to pay attention and go out there in the study. Once something's being constructed, it's very, very difficult to get anything added to the project. We've already bid it out. It's being constructed, so you're going to have change orders. It's going to be expensive. Times, the contractor isn't going to be real happy. So if it's being constructed and you want something changed, it's going to have to be very minor. I've seen some major projects change, but once it's in construction, it's pretty much to say in concrete. Not that it can't change, but you're going to have a lot more work, and it's only going to be in the minor changes. So if you want some big changes, start with the studies. This is for existing when you're going to go in and reconstruct it. Little bigger for the design, but and then construction are just minor changes to the plans that you can see out there. So that's to give an overview of what are you looking for? How are you going to change it? Do you want it to do new development? Do you want the existing to be changed? Do you want a 5-foot bike path, a 3-foot sidewalk? What do you want it to specifically look at? You can go down. You have subdivision, engineering standards, studies, and then the design plans itself. So moving on, is that we have national standards when we actually do design the road. So we're looking at, okay, we have a design out there. We look at national designs. We have the ITE, the National Institute of Transportation Engineers. They put standards out. They give us books. They say a local road should have this many vehicle trips per day, should have lane width this wide, parking should be this wide. I mean, get into the real specific of what the different roadways should look. Then you look at the AASHTO. You're going to have, it's commonly referred to as the Green Book. those are some of the bigger roadways that you're going to look at getting the geometry of what the intersection is going to look like, how you do the striping, what the signal timing is going to be. They're going to be very specific standards. Then you have the MUTCD is the design standard for all the traffic control, the stop signs, traffic signals, countdown timers, the striping itself, the turn lanes, where a signal can be orientated within the in the lane itself. So that gets into a very specific, and that's actually what's going to control any of the intersections. And they put warrants up of when a stop sign goes in, when four-way stops go in, and they have checklists to go ahead and go down. It's easier to do a stop sign than it is a single stop sign than a four-way stop, but they do have warrants. The signals have warrants, and they have studies that have to be done. But any of the signage that goes on typically is done for the MUTCD. These three, the ITE, the AASHTO, and the MUTCD, are standards, but there is no review or approve committee. They're more of designs of what we look at. It should be. They're not set in stone. We can make alterations. We can add some different signs that are not MUTCD. It's harder if you put them on federal highway routes or MDT routes, but they are mainly guidelines. We call them standards, but there isn't anyone that's actually approving them, so you don't have to submit the design in and say this is what it's going to be. We use our own judgment internally within the jurisdiction of either MDT or the city and can make some alterations to fit the case-by-case basis. However, when you get down to the ADA, American Disabilities Act, these are federal standards that are set in stone. You have to have ADA ramps if you have sidewalks at all intersections. You have to have the truncated domes. You have to have a landing. It's 2% cross slope on sidewalks. I mean, it's hard and fast. If we do not have an ADA compliant route, or it's a 3% cross slope for a sidewalk, we can be sued, and the city of Helena has had a complaint process where we had to go in and actually look at every ADA ramp in the city of Helena. We've had to change ADA ramps on Broadway. We put thousands and hundreds of thousands of dollars forward. We have to have a plan to bring us up to compliance with the ADA. So those are set in standard or set in concrete. Those you have to comply with, and they basically trump everything else. Stormwater runoff, ADA trumps it. Street trees, so ADA is the big overwhelming design that is out there, or standard. Then you look into the city, we have some regulations. We have the subdivision regulations. This is one that happened. We had a huge change in the subdivision regulations, not brought forward by staff, but by different organizations that went through our non-motorized committee, the Helena Citizens Council, and then directly to the commission to get sidewalks installed when the streets go in for the new subdivisions, and not with the building permit how previously was. They were waiting until the primary building was built, then they'd add the sidewalks. Well, you can go years of a new subdivision that goes in, has the streets in there, but the lots and buildings aren't going, so you can have a lack of sidewalks. We had a lot of public comment. We had an hour in the public hearing on this particular item, and that got changed by the commission. It's a way to get input. It was the right time to see if the global change, what the sidewalk, when you want sidewalks in, not what type of sidewalk, but those went in with change when you had an organized group that came forward. So that's one where you have seen changes. The engineering standards, we just updated them right before the subdivision regulations. We implemented the complete streets. MTAC, the non-motorized committee, was very vocal in that. The city county health department, they came in. We were able to make some tweaks, went to the commission, and try and incorporate it as much as we could without as much as we could as far as safety would allow to make changes in engineering standards. but that's when you're going to get a 5-foot sidewalk, say go to 6-foot sidewalk, or have a boulevard of 7 feet instead of 5 feet. We have those changes, and that came in on public input. When you have something that's organized, concise, and say, this is what we want to do, they look and reference some of the different design standards that are out there from ITE, some of the other bicycle institutes that are out there to make some changes and try and incorporate them into the engineering standards. So you did see the change. Then we have city codes. Those are basically the laws that we have to comply with, such as parking, or you have to go to the commission to, when parking is needed for some of the different zoning, you have to go to the commission to get variances. Then in the city of Helena, we have another resolution. This is another way that you can get facilitate change, is to get the city commission to adopt a resolution. It's not hard and fast, but says this is what we're striving for, is to get a complete street resolution in the city of Helena to say this is where we want to strive for, this is the overwhelming policy that we want to go with. Then we can take the resolution and adopt it in or incorporate it into the engineering standards. If you want to go onto the website, you can look at it. We even have a complete streets checklist where you have to check it off. Did you at least look at and justify all the different modes of transportation based on the classifications of the road? So take a look at that. You can use this in some of your different municipalities. This is where a complete street, and the commission was very happy at it. They can look at it and say, okay, it was justified. It wasn't willy-nilly. We had a reason we didn't incorporate, say, a bike lane or narrower streets or parking. Just that we have looked at everything, and if it doesn't go in, we actually justify it. This came up. This is the engineering standards that were proposed. Going through it quickly, you're looking at the staff proposed 10-foot lanes for local and minor arterials and collectors, a little wider based on emergency services input. They wanted it to be 10 feet, some of the different widths that are out there. Then this is what got adopted, is the groups came in and petitioned the commission or solicited the commission, talked to them during public meetings, and got it changed a foot less. So they're 9-foot lanes, 10-foot lanes instead of 10 and 11-foot lanes. So there was a lot of changes that came up, and then they have a deviation for on-street parking. The commission is very willing at this point to remove on-street parking to keep the streets narrower, so you reduce the speeds and try and do that travel demand of making people get rid of some of the cars that are out there. That's one of the ideas that was out there. If they don't have parking, make it difficult, make it better for bikers and walkers to try and help with the demand management. But that came in specifically with the engineering standards through public comment, with the commission, with city staff, came in, talked to city staff, went to the committees. That's how you facilitated some of the changes that were out there, and staff is pretty much always willing to look at any of it. And I can't speak for everyone, but they're always willing, everyone that I've talked to, if it comes in during the design standards. If you came in and asked, when we're doing engineering standards, that I want a sidewalk or curb extensions at this particular intersection, great idea. We'll still take it in under consideration, but it's bad timing. It's hard to follow up when there isn't a specific project out there, and we're looking at getting public comment for a specific reason. Then we have the different studies that you have to start to look at. This is the overall planning of the transportation plan. This is how you're going to get the existing system to change. You're going to get complete streets incorporated into the existing transportation network. You're going to have the Greater Helena Transportation Plan. Then if you want some specific needs, we'll look at some examples. A neighborhood plan. Neighborhoods get organized. Our traffic's going too fast. We don't have sidewalks. We have pedestrian issues. We have a winning group that got organized. Looking at speed studies. What should we set the speed limit to? If someone comes in and says our traffic's going too fast in front of our house, first thing we do is look at a speed study. Then we have some traffic plans. This is just in Helena. municipalities have it is you look at a specific region downtown and what improvements can happen to in that area. We did have EPA come in and do a Greening America's Capital. Can you start to incorporate and use economics to get stormwater controls, to have better landscaping, to make it more accessible to pedestrians, less friendly to motorized vehicles, to get people out of the cars, to get bicyclists to want to go downtown and interact a little bit more and slow the speeds by just looking at making it uncomfortable for vehicles. But this is where you start to look at getting changes made. Instead of waiting to the design, you do the study and say, all right, we need a project here. This is what the project is going to look like. So if you want a project, you pretty much have to start with the study. See, is it warranted? What is it going to be needed? Then basically the Greater Helena Transportation Plan, moving along, is the basic document for planning for the city of Helena or any of the municipalities that are out there. It sets the overall network for the improvements. Do we need the bike lanes? Do we need 4 lanes? Can we do road diets? Can we look at making a turn lane and putting bike lanes up there so you can facilitate more bicyclists, get people out of the car? This is the studies that we're going to look at. And this is for all over Helena, not just a specific region. We did have a separate motorized section. One I would put out there is look at trying to incorporate non-motorized with the overall plan, not just have a specific separate section that is out there. So if you're talking to different municipalities, that'd be one of my suggestions. This plan, once it's approved, it's been approved by MDT, the county, the city. We all look at this. This is the first thing we look at is when a study is approved, we look at it for the projects we want to do to prioritize the list and what is going to be needed in these plans. One thing that came up with real recently with the transportation plan is when you do maintenance, which is difference between maintenance and reconstruction, is maintenance is basically putting everything back as was, status quo, no changes, especially with MDT, is the Helena Bicycle Group wanted to put a bike lane in. It was a maintenance project and was not included in the Greater Helena Transportation Plan. That bike lane did not go in. It hadn't been vetted. It just came up at a very late date in the overall plan, and since it wasn't put into the plan, it was not incorporated into the MDT project. So you have to get started earlier. The earlier, the better. This is just the overall study that you're looking at. The city of Helena is a minor part of it as far as the overall geographical area, but you have the majority of the traffic and everything within the city of Helena. You look at it, some of the things that have come in that we have actually adopted into the city of Helena. This is looking at it for the recommended improvements for vehicles. The next slide will be the non-motorized section, but we've put in both the interchanges that are out there. This is the Custer interchange. This is South Helena interchange. We don't have some of the connections in. We are looking at adding another connection. So majority of the improvements that they've suggested, and this is through city staff and getting public input, have been incorporated into the city's projects and been completed. Then the next one we looked at the non-motorized. I think with this plan, looking at it, been through it for 10 years, is that I think it needs to be a little more specific. You have all these bike improvements, not saying they aren't needed or aren't warranted, and we're very far behind on, say, pedestrian or bicyclists, but you look at there's only, 10, 15 motorized issues that are out there that we can prioritize compared to basically the whole town. It's very hard to get a list when it's just a shotgun approach. Is look at what specifically needs to be done to get started in the next 10-year horizon, and that gives city staff an idea to go after it, and it's easier to go ahead and get a project completed when not a blanket approach. And that's just, for me, is looking at it is try and be very specific on what you want done, but because of this plan, there's the Broadway Tunnel. You're looking at the Centennial Trail for the city of Helena. but looking at everything around is specifically what do you need as a core group for the overall non-motorized transportation system, and just focus on that. It would be my suggestion. That's getting a little late, but any more questions, go over and talk. Then we can move on to some of the examples I have out there.
Yeah, so if folks have questions, go ahead and you can press *6 to unmute your phone line and ask the question live. Are there any questions out there? There are a couple questions that did pop up on the chat box, Ryan. One question was, how does the public know when designs are being considered? And then related question, are the design studies you mentioned publicly noticed?
Yes, the designs, to start with the studies and everything are publicly noted. We advertise it out there any way that we can. As far as designs, we usually use that through the commission process for the budget. Once the commission looks at everything and the budgetary process is put out as far as notice to the public, is we present our budget to the commission. The commission goes through, prioritizes what project they want to give through. But once it's budgeted, it pretty much is city staff that is going to go forward and start to design the project as time permits. Here in the city of Helena, a lot of the other municipalities may or may not do that, is they go to the committees and just contact or present the designs to the committees to get some of their input. But after it's been budgeted and we have a study of what it's going to look like, we don't go out for public notice unless it's a very big, major project that is undertaking, such as Custer Interchange or some of the other major projects. But smaller projects, we go forward and just present to the committee.
Great. Again, *6 if you'd like to unmute your phone and ask a question. Any other questions out there? Brian, one more question that did come up. A question about when a complete streets resolution is considered in the construction process. So the question is, is complete streets considered when new construction is considered, or is complete streets considered when new projects are developed? So basically, where in the process of developing a street project would a complete streets resolution be taken into account?
Let me try and answer it this way. The complete streets resolution is going to be looked at in the study phase. Is now that we have a resolution, we are looking at it not only in the study phase, it'll trickle on down, but that is where we try and incorporate all the needed elements for a particular corridor or particular street within the study. As we go into design is when we get specifically to look at what a complete street is going to have to look like for a particular section. So in the design, when we sit down and say, how many lanes do we need? Do we need boulevards, sidewalks, bike lanes? That is at the very beginning of the project. And then we have to consider, if it's an existing street, do we have right-of-way? If we don't have enough right-of-way, what is going to be removed? Such as a bike lane, do we remove parking, or do we look at removing a boulevard? Do we look at removing sidewalks on one side? We take that into consideration and look at it. So we can incorporate everything, but we also have to justify it and say what is going to be removed if we don't have enough right-of-way, can't purchase more right-of-way, what is going to actually come forward and rise to the top as far as being the priority. And we may have to go back to the commission if we cannot incorporate everything that is needed or has been designated in a study and in the complete streets. We may have to go to the commission, but typically we look at it on a case basis on an existing street. If it's a new street, we're saying everything has to go in or justify why not. That's how we incorporated it into the engineering standards.
Great, thanks, Ryan. Let's go ahead and finish up with your last segment of your presentation, and then we'll have another few minutes for questions at the end.
All right, hope I haven't put everyone to sleep. But moving ahead, I'm just going through some examples real quick. It'll probably be 5 minutes. Think of some of the other questions that are out there. These are all examples of where public input has come in, and some of them been specifically the right time, got something changed that a lot of people did not know on or was not on the radar of any of the cities. The Custer interchange, it got bike lanes put in. You have a roundabout that's put in. You're having sidewalks put in for all of the different development that's going on around the Custer interchange. This came in as a result of the transportation study. Then we also, for a major intersection, as the design was being developed, we actually held public meetings to get everyone's input, since this is such a vital area to the city of Helena and to an overall city is an interchange, major streets coming together. So we held specific public meetings to get input on this and on a particular project. And we have seen bike lanes that were incorporated all the way out to on Canyon Ferry Road. It just sort of dominoed all the way down on other MDT projects. And so that with everyone coming in, not only in the transportation plan, but standing up in public meetings during the design process, you were able to implement some change. The 11th Avenue project, this was during basically the construction, is groups came in, the Greater or the Bike Club of Helena went and talked to the non-motorized committee of Helena, and they came and talked to staff and city staff that talked to MDT to try and get a bike lane in, because it was designated as a bike lane in the transportation plan. We had a little more leverage, and MDT was willing to consider putting a bike lane in if the city commission would remove parking. So we were able to get everything put in. They put the bike lane in, put sidewalks in. It was a $500,000 change order, but MDT was willing to facilitate that based on public input to come in. Mill and overlay, I talked about that on Lyndale. A bike lane was asked for late in the game. It was not part of the transportation plan, so it was not installed. Then you have Airport Road on with the subdivision is Costco. City staff looked at it. It really wasn't put in the transportation plan, but we decided that we needed to help out and bolster the non-motorized element of it, and we got a multi-use path put in along Custer and on the other side, not just one side. So we're able to do that through subdivision and annexation. West Main and the city of Helena, we are looking at doing some improvements that were really looked at in the Helena Transportation Plan, but we went to the city non-motorized committee because they expressed a lot of interest in this particular project. So the public input came in, and we are putting a climbing lane. They made a change. We were just going to put bike lanes in on both sides, but now we're going to put a climbing lane, which is a bike lane on the uphill side, and a shared use path or a share the road on the downhill side, so we can have a boulevard along line 2, which helps with the complete streets. The gateway intersection, we had two different concepts, which was a roundabout or signalized. A lot of public input, made us do some changes as far as looking at different intersections in that area to facilitate transport or pedestrian and bicyclists. And then the viewed intersection, this came in. I have a couple pictures of that. Then the Broadway Tunnel. This was first brought up during our transportation plan, and MDT is currently putting it in at this time. It's going to be a great connection and help the overall bicycle route and the sections. Winnie Traffic Calming was a group. I'm just going to throw out a few ideas. They came in. They wanted something to take care of the overall volumes and speeds of the traveling public. This neighborhood group was very well organized and came in and got something done. The city sat down with them. We had several public meetings. However, with this group, one thing I will say is they were unwilling to bring any money forward. We did put in some speed tables. We did a minimalistic type view because they weren't willing to do an SID or an RID. And the speed tables were put in after a year. We did speed studies before and after. The speed tables as they were put in with no other features such as sidewalks or narrowing the overall street section, showed no change. They went in and the speeds were 95th percentile, were basically 30. Afterwards, they were at 29, so no real change. We were looking at trying to do sidewalks on opposite sides, try and spread the cost out, putting some raised intersections in, and going the whole width of the corridor to try and facilitate slower traffic and maybe reduce some of the volumes. However, the neighborhood group wasn't willing to put the money forward, so it just goes back in the priority. So this is where money talks and what you can get facilitated. This is what got put in. This is what city staff would like to do, but it would have been an RID. These are just temporary ones. We're looking at removing them. And since these went in, the neighborhood group has disbanded, so we don't have a real good organization, and there were several that started to splinter of maybe not wanting tables in and doing nothing. So to keep it organized, you need a point person. This is a Butte traffic circle that got put in with the CUP on an adjacent property owner or adjacent business that went in, new development. They had to do CUP. One person happened to be there, said traffic was a problem, and local roads. This is the Broadway Tunnel, great project by MDT. It goes underneath the interstate, and it's a dead-end road for the city. It's going to connect several routes that are being developed right now. So as a bicyclist and an overall biking transportation network, this is going to be a great project that was added as far as the transportation study. So that's the end. Sorry it takes so long, but leave a few minutes for questions.
Great, thanks a lot, Ryan. Lots of good detail there. Again, if you'd like to ask questions, feel free to pipe up, press *6. We have a couple that did come in on the chat window. I want to pass those on to you, Ryan. First of all, do MDT projects consider complete street resolutions in their projects?
They are changing, but it has taken a lot of prodding with the cities to make complete streets, and it's basically looked at per municipality that is around. We don't have an overall complete streets policy for the state. It's each individual municipality or city that is looking at a complete streets. Maybe a county can do that, but they're looking at it as a prodding from the local government. So the local governments are passing the complete streets. They are looking at it now, but it has to come up from the local government to tell MDT to take a look at it. There's no overwhelming policy that they have adopted.
On a related question, Ryan, again, this one came up on the chat. When you do a mill and overlay, do you look at complete streets or only on total reconstruction? And again, if you could just remind folks of what a mill and overlay is, that would be helpful.
A mill and overlay is a maintenance project where you come in and you mill out the top probably 2 inches or 3 inches of asphalt over a street. The under base is still good, but you're just removing the top course of the asphalt, and then coming in and putting another lift of asphalt over the top of it to try and prolong the life of that street. All the pavement markings are going to be removed, but the curb and gutter stays. So you're going to have your top back of curb going to be the same. So your typical section is going to be the same. And the way MDT has looked at it, and somewhat of the city is, especially MDT, because that's where you're looking at bike lanes and you need some more changes, they do not look at complete streets as far as making a change. They put back what was existing. So they keep it as status quo. However, through court cases, they do have to go in and look at ADA. So as far as complete streets of adding sidewalks or going outside the typical section, which is basically the curb and gutter, that's the scope of the project. No, they really don't look at it, and they don't look at expanding on it. They will look at adding a bike lane if parking is removed in certain circumstances. But to look at it, no, they don't for a maintenance type project.
Okay, another question that came in on the chat line. Brian, how can individuals become part of the new transportation planning group to rework the 2004 plan? And this is specifically related to the Helena area transportation plan. But as much as you could share for folks from outside of Helena, how can they, as individuals, get involved in transportation planning in their city? Just say a little bit more about that.
If you want to get involved, go to the city staff that is looking for it. There will be a designated point person. Ours is David Kanapke of the city of Helena, or you can contact me. We are going to take a look at it in the city of Helena. All the other ones are basically the same, the major metropolitan areas. Every 10 years we look at changing it. You go to city staff, the commission say, I'm interested in having input or being a part of the organized group, and that'll put it on to the radar. And as we progress down through the whole process of selecting a consultant, you will be notified and giving opportunities either on a work group, if you're going to have a work group, or in the public meetings. They are publicly advertised, so you just have to stay very alert and contact the staff person to say you want to specifically be contacted and know about some of the meetings that you can attend.
Thanks, Brian. We actually just had someone from the Great Falls group pipe up on the chat line to say that Andrew Finch is the contact there. Great Falls is undergoing a rework of a redo of their area transportation plan as well. Another question that came up, and this is it's actually from Alicia Thompson in Great Falls, and she, along with a number of other folks through the Montana Public Health Association, are working on a visual preference survey methodology to gauge people's interest in different types of roadways and their support for different types of roadway features. And the question is, how would results from a visual preference survey of this type be best presented to planners? Where would results from that kind of a survey be most helpful in the planning process, Ryan?
Results from that would be good anytime. We can take a look at it when we're developing projects. But if you happen to have it at a specific time where we have a study that is going on, that's going to be a little more beneficial, because timing is great. We can incorporate that information within the transportation study and take a holistic view at it. So if you can present them when they're doing transportation studies, it would be very beneficial. However, you can, in between the 10 years, because it is a long time, just present it to staff to look at during a budgetary process or at any time. It would be helpful.
Great. Thanks, Ryan. We're going to go ahead and wrap up. Thank you all for the questions today. I just want to wrap up by reminding folks that this presentation, including the audio, will be available at the Rural Health Initiative website. That webinar, or that website, is listed, should be listed on your screen. And also, I just want to mention details quickly about the last webinar in this particular series. We'll be covering more of this material from a different perspective. The third webinar is going to be with Roger Millar. Roger lives in Billings. He works with Smart Growth America. He's the director of their Leadership Institute, which provides technical assistance programs for state and local governments. He's also the director of the National Complete Streets Coalition. Roger is going to offer advice for how we can effectively reach out to potential partners in government, business, and civic organizations, and he'll share strategies for how best we can make the case for non-motorized transportation projects. You should have already received a registration link for this webinar. It was in the same email that you clicked on to register for this webinar. So take a look for that. We'll also be sending around reminder notices to register for Roger's webinar coming up on October 23rd from noon to 1:30. And then if you have further questions about how you can get your community involved with the Building Active Communities Initiative, please, you're encouraged to contact Kathy Kastakis, working on a new group of 6 communities starting this winter, and we'll kick things off with an Action Institute training featuring the walkability guru, Mark Benton. Before I turn it back over to Audrey, who has a short but very important survey for you to fill out, I want to thank Ryan for an excellent presentation, the Rural Health Initiative for hosting us, and all of you for joining us. So Audrey, go ahead and take it away.
Thank you everyone again for joining us today. That was a great presentation by Ryan. Like Ben said, there will be a quick little survey that will pop up when you exit the presentation today, and it's a few questions from Ben about today's webinar and a few questions from me about RHI webinars as a whole. It should take maybe a minute or two to fill out, and if you would all be so kind as to fill it out for me, that would be great. And that's all I have. Thank you again for joining us, and remember we've got that one more webinar coming up on the 23rd.